Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
If a tick latched onto your skin this instant, would you know the single safest move that keeps infection out of your bloodstream? Welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today you'll learn exactly how to remove a tick without turning a small bite into weeks of illness.
You might be surprised how often panic leads people to squeeze, burn, or smother a tick, actions that force harmful bacteria straight into you. Our goal is to replace that panic with precise steps so you stay calm, protected, and ready every time you head outdoors.
First, equip yourself with a single, indispensable tool, fine-tipped tweezers. Anything larger, or worse, your fingers, crushes the tick's body and pushes infectious material into you. Using the tweezers, position the tips right where the tick's mouth meets your skin.
Once you have that firm grip at the mouth, pull straight upward with slow, even pressure. Don't twist, jerk, or yank. That steady motion keeps the tick intact and keeps you from tearing its body, which lowers the chance of bacteria being released.
If part of the mouth breaks off, resist the urge to dig with needles or knives. Digging only injures your skin and invites new infection. Left alone, your body will push those fragments out naturally, just as it ejects a splinter.
That means you can clean the area with soap and water or rubbing alcohol, then simply monitor the spot. A small bump is normal. It should disappear within a few days and doesn't signal disease.
Forget folklore remedies. Matches, petroleum jelly, nail polish, and heat all irritate the tick and trigger it to regurgitate its gut contents into you. Each of those methods increases, not decreases, your risk of Lyme disease or other tick-borne illnesses.
After removal, disposal still matters. Never crush a tick between your fingers. Instead, wrap it in tape and throw it away, flush it down the toilet, or drop it into rubbing alcohol. If you want documentation, snap a quick photo and store the tick in a sealed bag in the freezer for reference.
Parents often rush to urgent care when they spot a tick on their child. The Children's Hospital of Philadelphia reminds you that you can handle most bites at home. Press the skin on either side of the tick to reduce discomfort, then use the same tweezers technique we just described.
Afterward, watch for a rash that grows larger than about 2.5 inches or any flu-like feelings. That's the signal to contact your pediatrician and mention exactly when and where the bite occurred.
Better still, avoid bites in the first place. Before stepping outside, choose light-colored long pants tucked into socks, a long-sleeve shirt, and natural repellent such as oil of lemon eucalyptus. These simple barriers make you a harder target.
When you come back inside, do a deliberate check of your back, crack, pits, and bits. The warm, hidden spots ticks favor. This quick habit turns daily shower time into a built-in safety scan.
Keep a sticky lint roller by the door. A few swipes over your clothes, or over a pet that joined you, can pull off ticks that are still crawling long before they dig in.
Ticks don't cling only to skin and fur. They hitch rides on backpacks, gardening gloves, and even picnic blankets. Before carrying those items indoors, give them a once-over, or keep them sealed in a plastic tote until you can treat them. That small step keeps your living space as tick-free as your skin.
When you launder outdoor gear, remember that ticks survive a cool water cycle. Wash on hot whenever fabric permits, and always finish with a 10-minute high-heat tumble. Those few extra minutes turn your washer and dryer into a reliable, chemical-free tick defense system.
Remember, most pathogens require a tick to stay attached for 24 to 48 hours. Daily checks tilt the odds strongly in your favor. One exception is the Powassan virus, which can transmit in as little as 15 minutes, making immediate checks even more important in high-risk areas.
Your clothing choices matter all year. Shoes instead of sandals, gloves, and a hat in brush-heavy zones, and long sleeves give ticks fewer landing zones. Each layer buys you time to remove them before they embed.
Stay on well-worn trails and keep your dog leashed. Ticks wait on tall grass, low shrubs, and leaf piles. Brushing against those edges is the moment they hitch a ride back to you or your pet.
As soon as you're indoors, jump in a warm shower and scrub with a washcloth. Ticks that haven't attached yet often rinse away. Then toss your clothes in a hot dryer for 10 minutes to finish off any stowaways.
If a bite slips through these defenses, remember the 5-step sequence. Use fine-tipped tweezers, grasp at the mouth, pull straight out, avoid digging if parts break, and dispose without crushing. Photograph the tick and watch the bite site for changes.
You've asked whether burning or suffocating a tick works. The answer is no. Those tricks make the tick vomit into you. Stick with tweezers close to the skin. That's the safest, fastest, and cleanest approach.
If the tick's mouth does stay behind, simply cleanse the area and let your immune system handle the fragment. Wrap the tick securely, freeze it if you want future identification, and keep an eye on how you feel over the next several days.
Here's your practical challenge. Before your next walk, assemble a small tick kit, fine-tipped tweezers, alcohol wipes, and a lint roller, and commit to a nightly scan of those hidden zones we discussed. With these steps, you protect yourself and the people you care about.
Before you put that kit away, place it where you actually use it, next to the door, in the glove compartment, or in your hiking pack. Prevention isn't effective if the tools sit in a drawer. Make it easy for yourself to grab tweezers and alcohol the moment you spot a tick.
Take a clear photo of every tick you remove and another of the bite area. Store those images with the date in your phone. If symptoms appear, that record gives your clinician a vital head start on identifying the species and estimating how long it might have fed.
Also jot down where you were, yard work, dog park, or wooded trail, so you can judge future risk and plan protective clothing accordingly. If you notice a flat pink rash expanding beyond 2.5 inches or develop feverish aches, contact your doctor promptly.
You might wonder how long a tick can wait before attaching. Studies show many ticks spend hours wandering on clothing, giving you a window to catch them. That fact alone makes a nightly full-body check one of the simplest, highest-impact habits you can adopt.
Another often overlooked safeguard is the dryer cycle. 10 minutes on high heat destroys ticks at every life stage, even the poppy seed-sized nymphs you can barely see. By tossing outdoor clothes straight into the dryer, you add a powerful final barrier after each adventure.
Don't forget your pets. Apply vet-approved repellents and run a comb through their fur after walks. A dog that wanders off trail can carry ticks straight onto your couch, bypassing every precaution you took for yourself.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.